I think we've all
Triggered.
been there, right? Yeah, trying to get our questions answered. It becomes even more difficult in an increasing digital world.
And when it comes to healthcare, it seems those questions only increase, right? Well, today we're learning from local people, local answers, and they really do exist, I promise.
Yeah, and if you live in Fayette or Greene counties, this conversation will be of particular interest to you.
And with us today from Peak Advantage, Missy Bazzo and the Director of Cardiology for Uniontown Hospital, Dr. Michael Desiderio. Thank you so much for being with us. This is so important now more than ever because every single bill, every single conversation that I have when it comes to healthcare, I just need someone to give it to me in layman's terms. Let's break it down and get a little simpler. And I want to talk about how healthcare is changing in these two counties specifically.
Sure. So we're really excited because we're kind of crossing that state border and we're coming into Fayette and Greene counties. So Peak Advantage is now going to give the extra access to care. Hence the reason why it's really important for both of us to be here because we're partnering with Uniontown Hospital to help out anybody that's on the Medicare Part A and B in those two counties, so we can help them with their extra access to care for that.
Awesome.
Yeah, and for you partnering with this larger healthcare system, how has that benefited you as a doctor, also your patients?
Well, partnering with WV Medicine allows us to deliver high quality care for patients in Fayette County, close to home.
Yeah.
It means that patients can get the vast majority of care in a neighborhood friendly community setting. And partnering with WV Medicine also allows us to have those extra resources when things get difficult and patients really need help.
Yeah,
absolutely. And working together as a community just makes so much more sense to make sure that you can help as many people as possible. Now, Missy, who can join Peak Advantage in Fayette and Greene counties?
So this is for anybody that has the Medicare Part A and B card. So that's their red, white, and blue card, regardless of age. And the great thing, today is October 15th, and that's the openness of AEP, which stands for Annual Election Period. So this is like the grand opening for anybody that needs to make their choices, and that ends on December 7th of this year.
My dad just retired, and I went through this with him, and it really does not have to be that difficult, and it's incredible to have this kind of utility local.
Right, and so, I mean, what does this really mean for patients, being able to gain access to more care overall?
So two parts. Whenever they choose to possibly join onto our plan, they actually have the access to care, and they can join either on our $0 plan premium or a low premium plan of $20. So we're also keeping it very, very low. But in addition, we just want to make sure that we're able to give them that extra access now to Uniontown Hospital, to all their doctors, and everything of what they need so they can live a healthier life locally.
Absolutely. Yes. And doctor, what routine screenings would you recommend for someone who is looking to join Peak Advantage?
Certainly having a great relationship with the primary care doctors to make sure that we stay updated for blood work, lipid panels, especially making sure the heart's healthy.
Very cool.
Yeah, and you mentioned something earlier. It's just, I assume that when you're seeing patients, I mean, they're dealing with issues with their heart and just maybe going through a really tough time. And you don't want to have to think about traveling really, really far to another healthcare system to receive good quality care. Is that the feedback that you're hearing from your patients?
Oh yeah, absolutely. We can do a lot at Uniontown Hospital, and for some of those more advanced things, most of it's done at Uniontown. There's a warm handoff to our partners down at Ruby and Morgantown for their definitive care.
That's
Absolutely.
Wonderful.
And Missy, are you hoping that this kind of just becomes the norm, just access to healthcare everywhere so that everyone can join together and take care of each other, essentially?
Yeah, that's what it's all about, is that we truly want to make the hometown healthier again. And so that's the mission of Peak Advantage, to just see on how we can love them as like our local neighbor and member of our plan.
Absolutely. Well, congratulations to you all on your collaboration. This is fantastic.
Thank you both.
How cool.
All right. Well, thank you to Peak Health and WVU Medicine Uniontown Hospital for sponsoring this segment. You can learn even more about your options for health insurance at kdka.com/talkpittsburgh.
And next on the show, from migrating monarch butterflies to blooms that stick around after the first frost, we're gardening for fall and getting tips to rest and recharge your plants. Talk Pittsburgh will be right back.